A straight leg raise is not just a straight leg raise. In fact, it is a very important clinical sign with numerous interpretations. Well, what's the first option? The first option is easy. The straight leg raise could be negative. The second option, in fact, is an option which is very frequent. We do the straight leg raise and we provoke end range pain. Where? Somewhere in the back or somewhere in the leg. Remember, you could provoke pain on the other side in the back. Yeah, we could provoke a crossed straight leg raise. I talked about this in another film. And let's not forget, on doing the straight leg raise, we always ask the patient to do an accessory neck flexion to interpret what is happening. Does the patient have more pain or less pain? And this was, of course, a very important dural sign. Another little detail in the straight leg raise is we'd always do it passively, slowly, and the moment the patient says it hurts, you stop. You analyze the pain and then continue. Try to go as far as possible, and perhaps we detect a painful arc on straight leg raise. And a painful arc on straight leg raise is a fantastic dural sign, pointing in the direction of a discodural conflict or internal derangement. The next stage in the straight leg raise is that you find a limitation of movement and pain, or limitation of movement, pain and motor deficit. And last option is that you find a slight limitation of movement with slight pain somewhere in the leg or in the back. But this is a particular case, specifically in chronic situations, that could be related to an adherent nerve root. This is a kind of dysfunction syndrome. Let's summarize the interpretation of the straight leg raise. Well, the first three options, a straight leg raise which is negative, or just end range pain on straight leg raise, pain in the back or in the leg or in the gluteal area, or a painful arc on straight leg raise, well, those things, they might go together with a small internal derangement, with a small discodural conflict. The moment the straight leg raise is painful and limited, we already have a bigger problem. It's a bigger internal derangement. The moment the straight leg raise is painful, limited, and in our examination we find some motor deficit, well, that means that there is serious compression on some nerve roots, disturbing the conduction, so this is a problem which is a little bit too big for conservative therapy. Let's imagine straight leg raise is completely negative, but in the examination we find a maximal deficit. Well, this is a serious problem. In fact, this is an ischemic root atrophy because of the compression on the nerve root, which is that big. At a certain moment the nerve root became ischemic and okay, no more pain, but maximal deficit. So this is a serious situation. And then we have, as a last option, an exceptional situation. Let's imagine the patient had a sciatica in the past, so he had a disc protrusion with pressure against the nerve root. He recuperated quite well from the sciatica, but he still has a slight limitation of the straight leg raise, slightly painful. Also slight limitation of flexion and standing, also slightly painful. That could go together with an adherent nerve root, which in fact is a dysfunction syndrome. So, straight leg raise is more than just a straight leg raise and is going to be a very valuable friend in order to come to a differential diagnosis in the lumbar spine.